Now we're going to turn to the UNFPA, and it's my privilege to invite Pernille FENGER to give us her take. And we know that we need to put the older person's right at the center of our activities. However, what does it take? Is it possible that the level of a fund such as the UNFPA, what does it take? And what is the UNFPA doing for this? Pernille.
Thank you very much, Alejandro, for this question. Well, good afternoon, ladies and gentlemen, colleagues. Let me first echo what has already been said a number of times. Older people's rights are systematically denied in all societies. Ageism is a global issue. It's prevalent in every social, economic, ethnic, geographical sphere, and in different contexts, including the workplace, media, healthcare, and in the public discourse. Older persons, they face multiple and intersecting problems, as also highlighted by my good colleague from WHO. And that is basically due to poverty, gender, living with disabilities, or belonging to a minority group that just exacerbate their situation. And states are obliged to respect, protect, and fulfill their rights, as it's been also pointed. And they do that by adopting policies in partnership with older persons' organizations, with deliberate actions and investments aiming at the full realization of their rights. And we need to empower older persons through investing in an active and healthy aging throughout the life course, at all levels, including social security, healthcare services, palliative care, it was also highlighted, housing and infrastructure. And how do we, as you are asking, Alejandro, how do we make a society that accommodates a society freer from ageism? And let me highlight a couple of areas where UNFPA is working. First of all, we need data. UNFPA is co-leading the data stream of the UN Decade of Healthy Aging, and the focus is especially on producing census-based briefs on the status of older persons. These censuses inform us about health, living conditions, and access to essential services, and that is our starting point. In addition to that, we have analyzed for the past years different waves of the World Values Survey that has for more than 40 years been at the forefront exploring values, beliefs, and attitudes that shape societies, including attitudes towards older persons. And what we see in those surveys is that negative attitudes towards older persons are pervasive and stand in the way of their full and productive integration in society. And this contributes to the baseline on which we can assess how older people are doing and to support countries in terms of tracking their commitments. The other area where UNFPA is focusing is on providing technical support in the formulation of strategies, policies, and programs. And of course, that we do together with our sister agencies, and where we address population aging, population decline, low fertility, and also migration. And to this end, we promote healthy and active aging, for example, through support of healthy aging centers. And in Southeast Asia, we're working to make these centers much more intergenerational, as we're moving away from the idea of creating just spaces for older people. We are now looking at more places where where people would also benefit from childcare, where older persons might be cooking for parents, and where essentially everyone benefit. And these programs we are doing under the umbrella of the Demographic Resilience Program. Well, the international community has invested resources and efforts for years to assess the level of recognition of older persons in existing international instruments, as has been highlighted before. And of course, whether to have an international convention or not, we as UNFPA are in the hands of member states. But we do need to ask ourselves a critical question. Are existing accountability and redress mechanisms working for older people? I started out by stating that older people's rights need to be respected, protected, and fulfilled. However, when we look at international human rights accountability mechanisms, such as the Universal Periodic Review, UPR, the level of attention given by member states to older persons' rights is meager. If we compare that to the attention given to other age population groups, we see a difference. There are many factors explaining this limited attention to older people's rights in the outcomes of human rights mechanisms. Yet, we find it's legitimate to ask ourselves if having a dedicated international instrument recognizing the specific rights of older persons would indeed contribute to a priority attention, as it's already happening with other population groups whose specific rights are internationally recognized. I thank you and wish you all a happy International Day of Older Persons.